You ever seen someone bite their nails until they bleed? Or twist a strand of hair around their finger until it rips out? Most people just call it a bad habit. But for millions, it's something deeper, something they can't stop, even when it hurts. Now imagine this. A 14-year-old girl named Maya sits alone in her bedroom. The door's locked, the lights are off. She's pulling at her hair, one strand at a time. Her scalp is raw, her pillow is covered in loose hair, and she can't stop. Not because she wants to feel pain, but because pulling it gives her just a second of relief. 1 second where the anxiety goes quiet. She's smart, funny, kind, but nobody knows this side of her. She hides under hoodies, pretends she's just tired when people comment on her hair. She's not looking for attention, she's trying not to break. This isn't just a nervous tic. It's called a body-focused repetitive behavior, or BFRB. And if you've never heard of it, you're not alone. But you should. Because right now, someone you know, maybe even you, is silently suffering from one of these disorders. And they've been told it's their fault, that they're just being weird, dramatic, or self-destructive. This video, we're going to break that silence. You'll learn what BFRBs are, why they happen, and how people live with them every day. And more importantly, what helps. Stick with me. This might just be the thing you or someone you care about needs to hear. Before we dive in, let me ask you something. Have you ever zoned out while scrolling on your phone, only to realize later that your fingers are raw from picking at a scab, or your nails are chewed down to nothing? Or maybe you've noticed your child or your partner doing something similar, but they laugh it off, say it's nothing. This is where it starts. Quiet, unnoticed, passed off as just stress, nerves, boredom. But for some people, these small acts become all-consuming rituals. In this video, we're going deep, not just into the science, but into the real lives behind the behaviors. We'll talk about the pressure to look perfect, the guilt that follows every relapse, and the mental load of hiding a part of yourself every single day. Because the truth is, the people who live with BFRBs aren't broken. They're just fighting a battle no one else sees. Let's talk about it. Maya was the kind of kid who teachers remembered. Straight A student, played piano, ran track. She always smiled in photos, the kind of smile that makes other people feel safe. But what no one knew was that behind that smile, Maya was unraveling. It started small, just tugging at her eyelashes while doing homework, then her eyebrows. By 8th grade, there were bald patches. She told her mom it was just stress. Her mom said, "You've got nothing to be stressed about." So Maya stayed quiet. In the hallways at school, people started to whisper. Some called her names. One boy asked if she had cancer. Another laughed and said she looked like a plucked chicken. She laughed along, pretending it didn't sting. But every night she sat in front of her mirror, scanning her scalp, pulling strand after strand. Not because she wanted to, but because she had to. The feeling built in her chest until it screamed, and only pulling could quiet it down. She Googled her symptoms late at night, found the word trichotillomania, read stories from strangers who sounded just like her. That night she cried, not because she was scared, but because for the first time, she didn't feel completely alone. But knowing what it was didn't stop it. She started hiding more. Hats, hoodies, thick eyeliner. She avoided pool parties, group photos, sleepovers. She told friends she had migraines, allergies, anything to avoid explaining why she always had to wear a hat indoors. Then one day, someone posted a photo on Instagram, a zoomed-in shot of her scalp during gym class. The caption? "Baldy's back at it." It got dozens of likes. Her phone blew up with notifications, and then it went silent. So did she. Maya didn't go to school the next day, or the day after that. Her parents thought she was being dramatic, but she was drowning. Not in sadness, but in shame. It took weeks before Maya even left her room. Her dad threatened to cut off her Wi-Fi if she didn't go back to school. Her mom kept saying, "You can't let them win." But this wasn't about them. It was about her body, her brain, her battle. One day, while scrolling YouTube, she found a video titled, "Why I Pull My Hair." It wasn't a clinical lecture. It was a girl her age, sitting in front of a webcam, makeup-free, showing her bald spots. She talked about the urges, the shame, the little wins that no one ever saw, like going a full day without pulling, or making it through an exam without digging into her scalp. Maya watched that video 3 times. Then she looked in the mirror, and for the first time, she didn't feel disgusted. She felt seen. That same week, she asked her school counselor for a private meeting. She didn't explain everything, just said she thought she needed help managing stress. It wasn't a perfect start. The counselor didn't know what trichotillomania was, but she listened. She pulled some strings and connected Maya with a therapist who specialized in body-focused repetitive behaviors. The therapist didn't fix Maya. She didn't offer a magic cure, but she gave Maya words for what she was feeling and tools, simple ones at first, like squeezing a stress ball or doodling when the urge hit. Then came the harder stuff, tracking triggers, journaling, being honest with herself about the days she slipped up. Slowly, the tight grip of shame started to loosen. Maya began pulling less, not because she hated herself, but because she finally believed she didn't deserve to suffer. She found an online community where people shared photos of their progress, not just before and after beauty shots, but real photos, raw ones, scalp scars, regrowth, smiles that didn't feel fake. She shared her own story there, at first anonymously, then under her name. By senior year, Maya gave a speech in front of her class. It wasn't about her grades or her scholarships. It was about mental health. She stood there, uncovered, bald spots and all. She told them what it meant to live with something invisible until it wasn't invisible anymore. There was a moment of silence when she finished. Then one person clapped. Then another. Then the whole room. After the speech, 3 different students came up to her. One said he'd been chewing his fingers raw since middle school. Another admitted she picked at her arms until they bled. The third just cried and hugged her. Maya's story isn't tied up in a perfect bow. She still has hard days. She still relapses. But now she knows what's happening. And more importantly, she knows she's not alone. Her story matters, just like yours does. And that's why we're talking about this today. Not to diagnose you, not to label anyone, but to shine a light on the behaviors people hide in the dark. Because sometimes telling the truth isn't just brave, it's life-changing. So what exactly are body-focused repetitive behaviors, BFRBs? They're not just bad habits, and they're not self-harm in the traditional sense. BFRBs are a group of compulsive behaviors where a person repeatedly damages their own body, often unintentionally, as a way to cope with anxiety, tension, or even boredom. The 2 most well-known BFRBs are trichotillomania and excoriation disorder. Let's break them down. Trichotillomania is the recurrent, irresistible urge to pull out your own hair. Scalp, eyelashes, eyebrows, anywhere there's hair, really. People who struggle with this often describe a mounting tension or anxiety that builds until the hair is pulled. And when it finally comes out, there's a fleeting sense of relief, even pleasure. But that relief doesn't last. What comes next is often shame, frustration, and self-blame. And the cycle starts again. Excoriation disorder, or skin picking, works in a similar way. A person will repeatedly pick at their skin, sometimes around a perceived imperfection, sometimes for no clear reason at all. They might use their fingers, tweezers, even their teeth. They might focus on their face, arms, hands, or scalp. And like hair pulling, the act provides a moment of calm, then regret. Here's the key point. These behaviors are not fully voluntary. Yes, someone is physically doing them, but they're not doing it for attention or because they want to. Often, they don't even realize they're doing it until after the damage is done. There are 2 types of engagement: focused and automatic. Focused means the person is aware, like when someone pulls hair to relieve stress. Automatic means it happens almost unconsciously, like someone biting their nails while watching TV, only realizing it after drawing blood. That's what makes BFRBs so complex. They're not fully habits, not fully addictions, not fully compulsions. They live in a gray area between impulse and relief, and they're hard to stop without help. What causes them? There's no single answer. Genetics play a role. BFRBs often run in families, but so do environment, trauma, stress, and mental health conditions like anxiety or OCD. And here's something many don't realize. BFRBs are incredibly common. Research suggests that about 1 in 20 people experience some form of BFRB in their lifetime. That's tens of millions of people. Yet most never get diagnosed. Why? Because of shame. Because they don't even know what they're dealing with has a name. Because society doesn't talk about these things openly. Instead, we call it weird, gross, attention-seeking. But those labels are wrong, and they're harmful. This is a mental health issue, and it deserves compassion, not judgment. And here's where it gets deeper, because BFRBs often don't show up alone. Many people with these behaviors also deal with anxiety, depression, OCD, ADHD, or trauma histories. For some, the pulling or picking starts in childhood. For others, it appears during puberty, a time when emotions run high and control feels just out of reach. And because it often starts so young, many people grow up believing it's just their weird thing, something they do in secret, something they'll grow out of. But for most, it doesn't just go away, it sticks. And it doesn't always look like pulling hair or picking skin. There are other BFRBs that don't get talked about as much. Nail biting, cheek chewing, lip biting, nose picking. All of these can be part of the same underlying struggle. Sometimes they escalate to the point of injury, bleeding cuticles, raw skin, infections, even permanent hair loss or scarring. But even when the damage isn't visible, the emotional toll can be enormous. Imagine constantly hiding your hands, refusing hugs because of the bald spots on your scalp, feeling like a freak for something your brain keeps doing to your body. That's why diagnosis matters. Not because it puts a label on someone, but because it gives them access to help, to language, to treatment, to relief. The DSM-5, which is the manual doctors use to diagnose mental health disorders, officially recognizes 2 BFRBs, trichotillomania and excoriation disorder. But just because the others aren't listed doesn't mean they're not real. If a behavior is causing distress or interfering with your life, it matters. Full stop. Understanding what BFRBs are is the first step, and for many, it's the step that turns shame into healing. One of the most confusing parts about BFRBs is how they can feel both automatic and intentional at the same time. Some people describe it like a trance. You're watching a show, reading, scrolling your phone, and suddenly you realize you've been picking at your skin or pulling your hair for minutes, maybe longer. You didn't even notice when it started. That's what we call the automatic mode. Other times, it's focused. You know exactly what you're doing. You feel the urge rising, the itch, the tension, the pressure under your skin. You try to resist, but eventually it builds too much, and you give in. It's like scratching an itch that won't go away until it bleeds. Both types are real. Both are valid, and both can coexist. Someone might go days without thinking about it, then spend an entire afternoon trapped in front of a mirror, scanning for the right hair or bump to pull or pick. It becomes a ritual, a cycle, and breaking it can feel like breaking part of yourself. This dual-track experience makes it especially difficult to explain to others. How do you describe a behavior you sometimes don't even know you're doing, but also can't stop yourself from doing, even when you're fully aware? People often say, just stop. But it's not that simple. You don't say, just stop to someone with a stutter or to someone with a panic attack. BFRBs operate from the same place, tangled wiring in the brain that responds to emotional overload with repetitive behavior. That's why self-control isn't always the issue. In fact, many people with BFRBs are incredibly disciplined in other areas of life. Straight-A students, perfectionists, people who push themselves hard until something pushes back. Understanding the automatic versus focused behavior is crucial because it helps people build the right coping strategies. You can't interrupt something you don't realize is happening, but once you do, you can start to take your power back. One helpful way to manage automatic behaviors is through environmental cues. For example, keeping your hands busy, using a textured object like a fidget cube, or wearing a bracelet can redirect the motion. Some people wear finger covers, gloves, or bandages to create a physical interruption to the unconscious habit. For focused episodes, the tools are different. That's where awareness techniques like journaling, urge tracking, and even guided meditation come in. The goal isn't to shame yourself out of the behavior, it's to catch the moment before it takes over. And here's something powerful. Simply recognizing that these two modes exist gives people permission to stop blaming themselves. It shifts the question from, "What's wrong with me?" to, "What's triggering me right now?" That mindset shift alone can be a huge part of healing. So whether you're picking at your skin during a stressful meeting or pulling your hair while watching a movie, you're not broken, you're human. And with the right strategies, these patterns can change. Let's talk about what no one wants to admit: how society treats people with BFRBs. We live in a world obsessed with appearances, clear skin, perfect hair, flawless selfies. So when someone pulls their own hair or picks at their skin, they're not just battling a mental health condition, they're fighting a culture that values image over authenticity. Think about it. When someone shows up with a cast on their arm, people rush to sign it. When someone shows up with bald patches or scabbed hands, people look away. Or worse, they judge. BFRBs are often seen as gross, self-inflicted, or attention-seeking. But you wouldn't say that about someone with eczema or migraines. So why is this different? The truth is, we've been trained to associate visible damage with weakness or failure. That if you were really in control, you wouldn't let yourself do this. But that's not how mental health works. Some of the strongest, smartest people deal with these behaviors. Doctors, athletes, artists, kids who ace every test, adults who manage families and careers. But they're also managing a battle most people never see, and often one they never talk about. Social media makes this worse. Platforms are full of edited images and curated lives. And when someone with a BFRB logs on, they're not just comparing themselves to friends, they're comparing themselves to filtered perfection. It's not just damaging, it's isolating. And isolation feeds the shame cycle. You feel broken, so you hide. You hide, so no one knows. And because no one knows, you feel more broken. The stigma doesn't just come from strangers either. It comes from doctors who don't ask the right questions, from parents who say, "Just stop," from schools that punish visible signs of distress instead of asking why they're happening. That's why awareness matters. That's why this conversation matters. Because the more we normalize talking about BFRBs, the less power shame has. And the more likely people are to seek help, speak up, and support each other. No one chooses to have a BFRB, but we can choose how we respond to those who do. Let's take a second to talk about how this stigma plays out in real life. A teen skips gym class every week because she's afraid someone will see the bald patches on her scalp. A college student avoids dating because he's ashamed of the scars on his hands. A mom wears long sleeves year-round, even in the summer, just so no one asks questions. These choices aren't just about embarrassment. They're about survival in a world that doesn't always make space for visible struggle. And what's worse? When people do speak up, they're often met with silence, or worse, dismissal. Everyone picks sometimes. You're overreacting. It's just a phase. But it's not a phase for everyone, and it's not a joke. It's a real condition, and for many, it's deeply painful, physically and emotionally. So how do we fix this? We start by listening, believing, learning. We stop assuming someone is fine just because they're quiet. We make room for honesty, even when it's uncomfortable. We ask better questions, and we teach kids and adults that mental health isn't something to be ashamed of. You don't have to fully understand someone's experience to show up for them. You just have to care enough not to look away. Because every time someone chooses to be visible with their struggle, it creates space for someone else to say, "Me too." And that's how change begins. Let's shift gears, because yes, BFRBs can feel overwhelming. Yes, they can last for years. But here's the good news: they're treatable. There isn't one magic cure, but there is a toolkit. And for many people, that toolkit has changed everything. The most well-known and effective approach is a form of cognitive behavioral therapy called habit reversal training, or HRT. It works by teaching you to recognize the moment an urge starts, and then substitute the behavior with something else that satisfies the same need. You still get relief, but in a way that doesn't harm you. Here's how it works. First, you become more aware of your behavior patterns. What time of day does it happen? What are you usually doing when it starts? What are you feeling before and after? Then, you learn to interrupt the cycle. If your hands tend to move to your face while studying, maybe you hold a smooth stone in one hand instead. If you pull your hair when you're anxious, maybe you practice deep breathing or clench your fists when you feel the tension coming on. It sounds simple, but it takes work, and for many it helps a lot. Another technique is something called decoupling. It's a bit newer and less structured. The idea is that you break the link between the urge and the action, not by suppressing it, but by redirecting it. So instead of picking at your skin, you might touch your arm in a different place. Or instead of pulling your hair, you make the same hand motion but toward a different object entirely. You're training your brain to follow a different path, not overnight, but over time those paths get stronger and the old ones get weaker. Now, therapy isn't the only option, but it's a great foundation. Some people also find relief with supplements like N-acetylcysteine, NAC, and adenositol. These aren't miracle pills, and they don't work for everyone. But there's growing evidence that they can reduce the intensity of urges for some people, especially when used alongside therapy. Of course, always check with a doctor before starting anything new. Just because it's over-the-counter doesn't mean it's risk-free. Then there are lifestyle practices that support emotional regulation and body awareness. Yoga, aerobic exercise, mindfulness meditation, journaling. These aren't cures, but they help strengthen the foundation that change can grow from. Biofeedback and hypnosis have also been explored, especially when other approaches haven't worked. They're less common, but for some, they've made a difference. What matters most isn't which tool you use first. It's that you start with something. Anything. Because the worst part of a BFRB isn't the behavior itself, it's the belief that you're stuck. You're not stuck. You're not broken. And you're not alone. Every small step, every time you become aware, every time you pause before the habit takes over, every time you talk about it instead of hiding it, that's healing. And healing doesn't have to mean being perfect. It can just mean being a little more free than you were yesterday. If you've made it this far into the video, thank you. That alone says something. Maybe you saw yourself in Maya's story. Maybe you recognized a friend. Maybe you just wanted to understand. Either way, here's what I want you to take with you. You are not the only one. And you don't have to carry this in silence. There's no shame in having a body-focused, repetitive behavior. There's only shame in a world that makes people feel like they can't talk about it. So let's change that. In the comments, if you feel safe, share your experience. Or just write "me too." Not for attention, but for connection, for visibility. Every time someone speaks up, it chips away at the isolation that so many people live in. And if this video helped you, if it made you feel seen or gave you something to think about, please hit the like button. Share it with someone who needs it. Subscribe if you want more videos like this, where we don't just explain mental health, we get it. We talk about the stuff that's hard to say out loud. This is Psych Too Deep, and this community is here to go deeper than the surface. We're not here for clickbait. We're here for connection. And hey, if you've been quietly struggling, this is your invitation. You are allowed to get help. You are allowed to talk about it. You are allowed to stop hiding. You are worthy of healing, even if it's messy, especially if it's messy. Thanks for watching. I'll see you in the next one.